we're gonna do PCA for pain medication for my patient. So first we're gonna look at the doctor's order and the patient's mark. So from the doctor's order, they gave an order for fentanyl, 10 micrograms, like out of 5 minutes. There's my physician's signature and another nurse for transcribed, and it's for Ward Tyson. Forward Tyson, so pin number 1, 2, 3, 4, 5, 6, 7, 8, 9, 24 years old, 24 years old, and once again, same thing, same for the MAR, fentanyl 10 micrograms, PCA dose of 10 micrograms, and a lockout of 5 minutes, and it's been transcribed twice, and once again, we have to look at the PDM. So, for the PDM, we make sure that we're looking at the PCA monograph for the fentanyl. So, fentanyl can be given PCA. It's a high-alert medication. So we make sure that we have naloxone available for us in case the patient has reaction, and it can be given by a student nurse. And we are looking at the PCA. So for the doctor's order of the fentanyl 10 micrograms, we would need this concentration recipe 10 micrograms per ml, and to get that I would need 500 mcg or 2 of the 50 mcg of the per ml of the fentanyl. And I got my supplies ready, and to do that, hand hygiene and then gather my supplies. I have my supplies ready for me, and I'm gonna do my first check for my truck and the doctor's order once again. So Ward Tyson, pin number 1, 2, 3, 4, 5, 6, 7, 8, 9, pin number 1, 2, 3, 4, 5, 6, 7, 8, 9, 24 years old, 24 years old, and the doctor has ordered fentanyl, 10 micrograms, or I will be considered 10 micrograms per ml. And same thing here, 10 micrograms per ml, a PCA dose of 10 micrograms, a lock out of 5 minutes, and I'm looking at the concentration from on my PDM of 10 micrograms per ml, and I would need a 500 micrograms of fentanyl, or 2 of the 50 mcg per ml, or that would be 10 ml of the fentanyl, and I would need a diluent of 40 ml normal saline. I have that ready right here. I have 50 ml, and I would remove 10 ml to get that 40 cc of normal saline, and the final volume of that would be 50 ml. Once I inject the 10 ml of fentanyl to here, that would be a total of 50 ml. Okay, so I will just prepare my medications. So I would do hand hygiene and do this for 30 seconds. Banana peel. And I would label that with my 10cc label. I've made my label earlier, and here. I'll put that aside. I'll stop this for 30 seconds. 30 seconds. And once again, I would need 5 ml from each vial to get that 10 cc of fentanyl. 5 ml in this vial, so I was only able to get about 4.5 here. So I'll make sure that I get that on the other vial. This vial has been used for multiple times, so that's one of the reasons why there's not enough there. But then in the wrong setting, you would get 5 here and 5 on the other vial. So once again, I would need 10 cc.
Okay, so I will do the second check.
And once again, I would need to label that. So for my second nurse will be able to understand what I put in here.
I asked the second nurse to confirm everything is correct.
Okay, so I would just need to get a second nurse to check this with me. So I'm gonna do my second check. So I would need Bart Tyson, and for my doctors, Bart Tyson, pin number 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 6, 7, 8, 9, 4 years old, 24 years old. Once again, it's ordered for fentanyl 10 micrograms per ml. I have 10 micrograms per ml. To get that, I would need the concentrated times mcg of per ml, or the 500 mcg, or the 2 of the 50 mcg of per ml from this vial. So I have that. So I have that fentanyl right here, and I have fentanyl, and I would need about 10 cc of fentanyl. I have 10 cc right here, and I would need a diluent of 40 ml normal saline. I have 10 cc of normal saline here. I removed that from the 50 cc to get that 40 cc of normal saline. And the doctor has ordered 10 micrograms, and I wrote that in my second here, my calculation. And a lock out of 5 minutes, and it's not continuous, so I would label that. So, and it has been given today, and it has been transcribed twice, so I could give this medication. So after the second nurse has acknowledged that everything is good, I can inject this 10 cc of fentanyl on my. I will just grab a swab. Seconds. When that's dry, once again, fentanyl 10 cc. I have 10 cc right here, and that would be a total of 50 ml on this bag. And here's my label, and then I'm just gonna stick that on the side right there, side to side. I'm just gonna go to my patient's room, and once I get to my patient's room, I'm gonna do hand hygiene and confirm that I have the right patient. So hello, my name is Mariam, student nurse. Can you please state your full name? So Bart Tyson, I confirm that you're my patient. I can also confirm that on their wristband. So Bart Tyson, and then how old are you? 7 years old, so they have the right patient here. And so Mr. Tyson, your doctor has ordered for you PCA, or pain medication for you. This medication, you can use this button. Once you click this, it would. Once you hear that beep, it means it has infused on your in your system, and then you can get your pain medication. And you have to wait for about 5 minutes or so to get another dose of that medication. If you have any unusual feeling after you got that medication, it's important that you tell me, and you can use the cobble. The cobble will be just right on the other side of your bed, and you can use that to call me if you feel any short of breath or dizziness, or if you feel any hives or any itchiness that you might feel or any unusual, and you consent that I give you this medication. Okay, I've got the consent of my patient, so I'll just ready my PCA. So I'll just turn this on. And the code would be just on the back. Okay, so we make sure that we have the right unit. So we need micrograms. So we have micrograms right there, and we would need a concentration of 10 micrograms per ml. So yes, do that. So I would need 10 micrograms, and it's an IV, and this can be given IV. There's no loading dose that was ordered, so this one would be 0. And for safety, this would be off. For a bag volume, we have 50 cc. Basal rate, it's not continuous, so that would be 0. So the bolus would be 10 micrograms. And the lockout of 5 minutes. Bolus per hour, so if you divide 60 divided by 5, I will just get my phone to calculate that. So 60 divided by 5, that will be 12. Oh. So yes, done. Yes. So I will just get my second nurse to check or review the PCA with me, and once I get the confirmation that it's all right, I could hook my bag. And also make sure that you got the key to open the PCA. I will just let my second nurse to hold this previous bag. Once you close this, before you start, make sure that we ask the patient if there's any pain on the side of the IV, or if it looks red, or if there's pain in here, it looks patent, and there's no leaking that's happening. Make sure that it's not clamped. And we have a carrier running, and make sure it's running normal saline that's compatible with our PCA. And we would just run this. once you see the green blinking, that means it's ready for this to run once the patient has clicked your PCA button. So, Mr. Tyson, if you have any concerns, you can use the call bell on the other side of your bed. And once again, you have this button for your PCA for you to use. If you have any pain, you can just use this to click, and you just have to wait for that beep. Once you hear that beep, it means that the medication is infusing, and you have to wait for another 5 minutes or so to get another dose of that. So, and once again, if you have any unusual reaction, you can call me so that I could stop the PCA and we could check on what's happening on you. And if you have any other concerns, patient said no, and after that we could mark it down on the mark that we've given the change the bag of the PCA. And we do a quick safety check, exit check, and everything is good. Once again, it's green light, it's beeping, and it's good. And yeah.
Okay.